The State Assembly approved the first phase of the health care plan yesterday. The measure would require almost everyone in the state of California to have insurance. But critics say the plan will lead to higher taxes. For more on this, let's go to our Channel 4 Conan Nolan. He is live for us in Burbank, where it's still raining. Conan.
Colleen, in front of St. Joseph's Medical Center, one of scores of Southern California hospitals that will face higher taxes as a result of this measure, but they'll get quite a few more patients as well. This is a revolutionary compromise, but as you point out, not without its critics, including some who believe this is less about healing the sick than about comforting the well-connected.
The governor today with Assembly Speaker Fabian Nunez celebrating their first victory in the health care fight, following passage in the State Assembly of a reform measure historic in scope.
This is absolute heaven for the people, because the people are going to get the ultimate service and the best health care system that we've seen in the United States, anywhere, any state.
The measure would require all California residents to purchase health insurance, with subsidies and tax credits for those who can't afford it. Voters would need to approve its funding at a cost of $14.4 billion. It would require tax hikes to businesses that don't already pay for health care, along with a tobacco tax and a tax on hospitals. The compromise has no shortage of critics. Conservatives say average Californians will end up paying more in taxes. The State Chamber of Commerce and the Restaurant Association are all opposed. And others wonder about its timing, with the state $15 billion in the red.
The governor's declared a state of fiscal emergency.
And progressive groups also oppose the deal. They see it as a gift to the health insurance industry.
So this is the government forcing people to buy a private insurance policy that's unregulated in terms of its price, and that costs on average, according to the Kaiser Family Foundation, $12,000 a year for a family of four.
And then there are the financial ties from businesses and unions that benefit from the health care proposal to the Prop 93 ballot campaign to extend legislative term limits, such as that of the Assembly Speaker.
Whether somebody else or, a business group or a union or someone else decides to support Prop 93, that's a separate matter altogether.
California State Senate may take up this measure in January, just before the February primary in this state, when voters will decide whether those very lawmakers should remain in office. I'm Conan Nolan, reporting live in Burbank, Channel 4 News.